it's an oral presentation time. We're excited to introduce the first paper's presenters, Tianyu and Feng on the paper entitled Intelligent Virtual Sonographer, IVS, Enhancing Physician-Robot-Patient Communications. Welcome.
Can we back to the start one? The first slide, thank you. Hello everyone, my name is Feng. Here's my colleague Tianyu. We are so excited to present our work today. And our work is Intelligent Virtual Sonographer Enhancing Physician-Robot-Patient Communication. Let's start with the scenario. In the picture on the left side, there is a physician sitting in their office. And on the right side, a patient is alone in the examination room with a robotic ultrasound device. In this picture, we want to show if the physician wants to acquire some information and also monitor the exam, while the patients also need to some support. Like the patient needs to know how to cooperate with the physician and the robot. What should they do? So if I'm the patient, when I'm facing this system, I would be a little bit nervous and even a little bit afraid of them because I'm not familiar with that.
And if I'm the physician sitting in an office and doing this remote monitoring of the robotic ultrasound procedure, I will be also wondering with a few questions, like how is the patient currently feeling? Is the robot functioning correctly? And what if I want to do some adjustment to this procedure to, for example, apply a little additional pressure? Will the robot actually do its job?
Yes, exactly. So the key questions here is how can we create a remote interactive system that earns physicians' trust, gains patient acceptance, and improves diagnostic efficiency. Our solution here is to introduce the intelligent virtual sonographer, which assists both the physician and patient. The challenge here lies in understanding the intent, status, and requests between each of them. Our contribution here is to build this triangle relationship to bridge the gap between each of them. Okay, so let's dive into the details. First of all, I would like to introduce our robotic ultrasound system. As we can see here, we mounted an ultrasound probe and a RGBD camera on our robotic, end effect of the robot arm. And we can see the arm view here. And our system can get the scan segmentation to detect the arm. Then we generate the scan path. Both the 3D point cloud and plan parts are transmitted to the physician side for visualization and better understanding. This short video shows the automatic scan process. During the procedure, our system analyzes the intent during the normal conversation and translate it into different commands to ensure the robot can execute the correct action. Okay. Then I would like to ask another question. So how can we build the relationship between the robotic ultrasound and the physician?
Well, in order to present all this information of the robotic ultrasound system to the physician will wear the head-mounted display. In the head-mounted display, we will show the physician a virtual sonographer, and this virtual sonographer will present, like, for example, the ultrasound image stream and also the reconstructed patient's arm with the scanning trajectory to the physician as well. And in order for the physician to be able to communicate with this virtual sonographer, we also develop a conversational pipeline where we employ speech-to-text service large language model, and also the text-to-speech service that is actually running completely locally in the hospital. And in order for the virtual sonographer to understand what is happening with the robot, there's also communication between the robot and the virtual sonographer. For example, the system status is being communicated to the large language model, and our large language model is also trying to interpret the intent of the physician and translate this into the robot command to basically adjust the robot parameters. We also have body language for the virtual sonographer. We use different animations, like the pre-baked animations of like breathing, eye blinking, but we also have procedurally generated animation for the virtual sonographer. For example, when the ultrasound scanning starts, the virtual sonographer will actually grab onto the ultrasound probe and follow the motion of the ultrasound probe on the patient's arm, as if the virtual sonographer is actually doing the scan on the patient. And we actually developed a very similar architecture for the virtual sonographer on the patient side as well. But the most important work of our system is this communication between these two large language models. I can give you an example. So for example, if I'm the physician, before the start of the scan, I would like to understand the patient information, like what's the name of the patient, what's the previous medical history of the patient, is it actually relevant to what we are doing today? And the virtual sonographer could answer me like this.
The patient is Mr. Lee, with a reported injury to the right arm, which may be relevant to today's vascular assessment.
And during the procedure, when I want to actually adjust some of the robot parameters, like for example, when the ultrasound image stream is not that clear, I want to apply a little bit more pressure. I will tell this to a virtual sonographer, and I hope the virtual sonographer could translate this into a robot action and basically acknowledge what I want to do. And she could say something like this.
Sure, I applied slight additional pressure here to obtain a clearer view.
At this moment, as a patient here, I feel a little bit more pressure on my arm from the robot. And I'm a little bit nervous at that time. I would ask for some, for the virtual sonographer to know what's going on. And the virtual sonographer would say like this.
The physician just needs a clearer view in this area, so I'm applying a little extra pressure with the probe. It might feel slightly firm, but it shouldn't be painful. Please try to stay still and relax.
And sometimes if I'm in a situation like I felt discomfort, I would make some request, and I also get the response from the virtual sonographer.
I understand. Thank you for letting me know. We can pause the exam right away and will only continue if you feel.
And as the physician, of course, I care about the patient comfort. When I see the robot suddenly stop, the procedure is paused, I'm also wondering what is happening. At this time, I hope the virtual sonographer could actually actively communicate this situation to me. So she could say something like this.
The patient reported discomfort during the procedure and requested to stop. So I have paused the examination.
So we actually evaluated this system. We conducted a user study with 7 medical doctors and 7 biomedical engineers. We evaluated the communication effectiveness, the perceived intelligence and interaction quality of the virtual sonographer, as well as the usability and overall satisfaction of the system. So based on the results, we can see that across different categories of the communication, the accuracy is around 85% to 90%. But this accuracy could actually improve, as currently the large language model is literally evolving at the speed of light. And there's a lot of new techniques that could reduce the hallucination of the LLM and also improve the intelligence. And in terms of subjective ratings, in a scale of 1 to 5, we can see that actually the rating is really, really good. But actually the biomedical engineers has slightly higher ratings than the medical doctors. So far, we have only shown you the scenarios where the patient and physician are located into 2 different rooms. But what if they're actually on the opposite side of the ward, or even speak different languages? And we actually created this demo back in April, where the people in Munich is acting as a patient, and the people in Hong Kong act as a physician, talking to a virtual sonographer that is actually on the 2D screen through Zoom. Where the physician is basically remote monitoring this whole process and communicate to the sonographer. And let me show you a short video.
请问病人叫什么名字？
我现在会问患者，然后告诉您。
Can you tell me your name, please?
My name is Michael.
Great, nice to meet you, Michael.
好的，患者的姓名是迈克尔。
轨迹正确的开始检查。
明白了，现在开始扫描。
The scan is now in progress. Please stay still and stay relaxed. Let me know if you feel any discomfort.
顺便说一句，我在超声图像上用红色标记了血管。
So in conclusion, our intelligent virtual sonographer enhances the physician-robot-patient communication, and we hope that our system could build trust between the physician and the robot, increase the patient acceptance of the robotic ultrasound system, and eventually enhances the diagnostic efficiency. If you want to see more videos and wonder how we implement this whole system, you can scan the QR code. We open source our code on GitHub as well, and thank you for your attention.
Thank you so much.